Hello friends, Assalamu alaikum. This is Dr. Whitecoat, and today we are going to talk about hypertrophic obstructive cardiomyopathy. Now, first of all, what is hypertrophic obstructive cardiomyopathy? This is a disorder of cardiac muscle tissue, and it is autosomal dominant in nature, and its prevalence is high in 1 in 500 people, and it is the most common cause of sudden cardiac death in young people. A sudden death in healthy young people during playing football or exercising is suggestive of hypertrophic obstructive cardiomyopathy. What are the features? Features are the patient may present to you with chest pain, dyspnea, syncope, palpitation, and sometimes he may be present to you after death, that is sudden cardiac death. The patient may be even asymptomatic. On examination, you will find jerky pulse, double apex beat. There may be large air wave in JVP waveform, and auscultation you may find ejection systolic murmur. The poor prognostic factor of hypertrophic obstructive cardiomyopathy is syncope, young age at presentation, family history of sudden cardiac death in young people, and non-sustained ventricular tachycardia on Holter monitoring, abnormal blood pressure changes on exercise, and increased septal wall thickness more than 3 cm. And now the association of the disease. Hypertrophic obstructive cardiomyopathy is associated with Friedreich's ataxia and WPW syndrome. The investigation of choice is ECG, and you will find right bundle branch block, and there may be prolonged PR interval, left ventricular hypertrophy, and there may be deep Q wave in anterior and inferior lead of ECG. And echo findings are: there may be mitral regurgitation, systolic anterior motion of anterior mitral valve leaflet, and there may be asymmetric hypertrophy. Now, how to manage the disease? The management is A, B, C, D, and E. Here A stands for amiodarone, B stands for beta blocker, C is implantable cardiac defibrillator, D for dual chamber pacemaker, and endocarditis prophylaxis. Now, there are some drugs we should avoid in hypertrophic obstructive cardiomyopathy because these drugs will deteriorate the condition of the patient. And these drugs are nitrates, number 1, number 2, ACE inhibitor, and number 3, inotropes. That is noradrenaline, adrenaline, etc. And now, what are the other causes of sudden cardiac death in young healthy individual? The second most common cause of sudden cardiac death is arrhythmogenic right ventricular cardiomyopathy, catecholaminergic polymorphic ventricular tachycardia, and Brugada syndrome, which is common in Asian people. Screening. How can we detect the patients? How can we detect the asymptomatic patients? Number 1 is ECG, and number 2, transthoracic echocardiography. Genetic testing is not recommended for screening. Thank you. Have a very nice day. And if you like my presentation, please like and subscribe us and share it with your friends. Thank you.